Welcome to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. So hop on and have some fun while Liz navigates this medical mystery ride. Call 888-565-1470 and ask Liz, your source for the latest medical technology and long life advice. All aboard. Here's Liz Goodman.
Hi, this is Dr. Frank Snipes. I've been on the show before, internal medicine, and joining me today is Dr. Michelle Kerwin, and she's a pediatrician. We both work at a similar clinic in Miami Gardens called the Center for Family and Child Enrichment in Miami Gardens, and we can give you the address of that a little later. Basically, Liz Goodman is out today. She's not feeling well, and she's out of town as well, so I'm going to step into her place, if that's at all possible, and try to make the best of this. The topic that we thought we would do this evening is depression, because depression is a topic that I like to treat. I think it's extremely important in primary care and certainly in pediatrics as well, and even indirectly in pediatrics, because if the family and the parents are depressed, that relates to the children and how they respond to the parents who have depression. Overall, in general, we're trying to discuss this because roughly it's about 15 million people in the United States have at any time depression, and roughly only 2/3 get treated, and men are a big portion of that don't get treated. So I really have a sensitivity for that. So basically, I just want to bring up just a little bit of a discussion with Dr. Kerwin here, as she is a pediatrician, and even though they may or may not treat depression specifically with children, or at least how they deal with it in our clinic at the Center for Family and Child Enrichment in Miami Gardens. So, in general, Dr. Kerwin, as a pediatrician, how do you approach children with depression?
Well, we screen all children that are age 12 and up for depression. We have a screen that's called PHQ-2, PHQ-A, and so every child that comes in every year for their well child check, that is age 12 and up, will be screened. And if we see any red flags, let's say they don't meet the criteria for depression, but we see a few red flags, then we would probably follow them up in maybe 3 months or 2 months, depending on the situation. If they meet the criteria for mild to moderate depression, then it's an automatic referral to our behavioral health therapists or our psychiatrists. We have licensed clinical social workers that can see the child and evaluate them. If there are significant red flags like suicidal ideation or homicidal ideation, then we would try to bring the psychiatrist to speak to them immediately, or one of the therapists to speak to them while they're in our office, or we could have them Baker acted if that's, a necessity. Yeah. So it is something that we, take very seriously. We follow with each child. We make sure that we talk to the child, and we speak to the child alone. So we pull every kid 12 and up alone, whether we think they're depressed or not, and we speak to them about depression symptoms. We speak to them about tobacco, alcohol, drugs, and sex as well. And it's an entirely confidential conversation.
And that's important because basically you talk to them apart. You don't talk to them
from the
with their parent there, so they can certainly. And we were talking just before the show a little bit about how bullying affects that, and that's a whole topic for an entire different show. That's a whole different arena. But basically, you see it sometimes where children will be bullied and they're getting depressed and their behavior changes, their grades change, and so on.
Absolutely.
So again, we'll deal with that in the near future. And at the Center for Family and Child Enrichment in Miami, we'll give you the address in a moment, we do have psychiatrists on staff, as well as a host of psychologists and so on.
Correct.
So they're there on campus.
Yes, for children and for adults as well.
And they're there on campus, so they could real time be okay as opposed to... They
do individual therapy, they do family therapy, anger management, parenting, domestic violence therapies, trauma-informed care. So they deal with a lot of real significant social issues. And of course, you're going to see depression related to these issues, and they do treat. We treat patients in conjunction with the psychiatrist. Many of my patients that have psychosocial issues, depression, anxiety, mental illness, the psychiatrist and I, or the psychologist or therapist and I, we converse about our patients on a regular basis, and so that we're both on the same page in terms of their medical care and their psychiatric
So there's
care.
a coordination certainly between the two.
Yes, absolutely.
Can you speak just for a minute as to how, as a parent out there to the listening audience, know that their child is not being just a teenage years, but maybe they really are depressed? There's more going on than just being a rebellious youth, as they say.
Yeah, you would see more significant changes. Teenagers are difficult by nature, and maybe more difficult this newer generation. But things like sleeping more or sleeping less, loss of appetite or eating more, keeping to themselves, losing interest in things that they normally have interest in. They may say things. They might talk about, being down, or they might talk about, wanting to hurt themselves or hurt somebody else, maybe jokingly. Always look for cutting marks on the wrists.
Now, what are cutting marks?
They would look like just little lines, and they're
Like
usually
little slits, like
little
from a
slits,
razor or
yes,
so?
and they
Okay.
might be healed. And I check all of my patients, all of my kids. I look at their arms, and I specifically look at the wrist. From younger ages than 12, I specifically look at the wrist for little marks, and they might be healed. You're not necessarily going to see a mark that's fresh because they're going to hide that. But I have caught several patients with cutting marks on their arms, on their wrists. I'll pull them aside in their teen talk, and I'll ask them about it directly. And I've, it's difficult for the child sometimes to tell the parent that obviously that they're cutting, or that they're depressed or anxious or what have you. I work with the child and figure out a way that we together can talk to the parent. I'll do the talking, you do the talking. You don't even have to be in the room if you don't want to do the talking, if you're embarrassed or whatever.
And one final comment is, oftentimes in a family, I can even speak to my own family, we get lost in the family. And sometimes you just think, oh, Rebecca's just being Rebecca, but maybe she's not. And it affects her whole life. I mean, not only the fact of, obviously, God forbid, suicide, but also just poor grades, and it relates to how she eats, obesity, and I'm sure you see childhood obesity as a manifestation of all that.
Yes,
and so it really does.
Yeah.
Speaking from the internal medicine, the adult physician side, basically it's subtle. It is tremendously subtle with most patients. They come in quite often complaining of maybe a blood pressure check or their diabetes evaluation, and just letting them speak for a few minutes and getting a relationship with them, and all of a sudden they burst out in tears, or they have a problem with their marriage or whatever. And so I try to be a little slower, leaving people a chance to let that evolve. And I think that's where the primary care, whether it be pediatrics or internal medicine and family practice, are extremely important. Because if you can develop a relationship and not just a hello, goodbye, here's your prescription, which is horrible. Yeah. But if you can really develop a relationship with these patients, then you can let them feel vulnerable and in a safe place to let this vent.
And really, physicians need to ask the question. Physicians get worried about opening that can of worms because you have 15 minutes per patient.
That's a very good point.
Insurance companies reimburse, and the way medicine has moved, you really have to increase the amount of patients you see per hour or per day. And so, many physicians are uncomfortable asking those questions because once they've taken care of the hypertension, the diabetes, and the rash on the foot, okay, so how are you feeling? You don't really want to hear, or see the tears because, okay, now that's another half hour. I can't be insensitive and say, okay, you're crying. It's okay. Let me refer you to the psychiatrist. I'll see you in a month to check your diabetes again, So, I think that's a problem with medicine and insurance reimbursement and so on that really needs to be addressed so that we can have that time with the patient. Either that, or we need to have on-site help. And we are fortunate at Center for Family and Child Enrichment to have that on-site help where I can say, okay, let me grab a psychiatrist, let you speak with them for a little while. I'll step out, see another 2 patients, and come back in, So I think that's one of the excellent things about CFCE is that we do have that backup support. And, I take my time with my patients. I'm a stickler for spending my time, and I know you are as well.
Yeah, at the risk of being yelled at by office personnel, yes. But it makes a big difference. But it's a real topic that's serious. And here's the one thing I want the listening audience to know. I can't speak too much about pediatric depression, but certainly with adult medicine, there's tremendous therapy out there. And I think one of the stigmas, which is not a stigma, and that's one thing I want to really stress tonight, is that it is not a stigma. It is just as common, or certainly is along the lines of diabetes, hypertension, what have you, and cancers, whatever. It's a treatable illness. And I think a lot of people push it under the rug, particularly you men out there, push it under the rug and don't really get treated.
People don't want to be seen as weak.
They do.
They feel that they'll be seen as weak.
I'm glad you brought that up, because oftentimes I will say this very blunt thing to patients. I'll say, here's the elephant in the room. Number one, you're not weak. You're not stupid. You're not flaky. You're not silly. You're not ungrateful. A lot of patients think that indeed they have patients that are ungrateful and such, and that they have such a great life, and they have a nice car, and they have a nice husband and such, and they just they shouldn't feel depressed. So I want to really take away that curtain, basically, and it is not a stigma, and it makes a tremendous difference. There are good treatments out there that do work, in addition to non-pharmacologic treatments like things as therapy and such, and meditation and yoga. So we're not just sitting here pounding the book on medications. Certainly that's one of a whole pie of different things to treat it. So
and I think it's important for parents to realize that, or families, adults, patients, or what have you, to realize that even if you do get on a depression medication, it doesn't necessarily mean that that's for the rest of your life.
Absolutely.
It can be a hormonal imbalance. Let's get things back balanced again, and then do your therapy for, let's say, 6 months, and then visit the possibility of maybe coming off of depression medications. It might be possible, it may not be. But sometimes people just need to work through the past, or work through the unforgiveness that's in their heart about whatever situation, or my parents did this, or my parents didn't do this. And once they can work through and forgive and let go and release, then maybe some forms of depression are situational, what we call situational depression, and they can come off of the medication. But you don't know until you get that balance and you get that therapy and you work through it. So there are a lot of people that come off of it.
Well, that's true, and those are good points you're bringing up. And I was told that Liz Goodman's on the line. Is that right?
Awesome.
Hello,
Hi,
Liz.
how are you guys?
Well,
Hi,
hello.
Liz.
How are you feeling?
I'm still sitting in the dentist chair. I've been here for about 5 hours. So I want to give a shout out to my Dr. LaSorsa, who is here in Davenport taking care of me. Thanks, Doc.
Well, good.
And I wanted to thank you guys for covering the show tonight. I can hear while I'm sitting here you're doing a fabulous job, and you guys are having a very serious conversation about something very important, and I'm sorry I'm not there to be a part of it, and I'd like to invite you back again another time that we can take up this conversation again.
Well, not a problem. Just remember us at Christmas. Well, in general, yeah. So you'll be back next week. Is that right?
No, I will not be back next week. I'll be back the week after. So if you guys want to do another show next week, well, we can certainly have you do that, or we can do a rerun if we have to. But I do have to get back into the dentist chair. I just wanted to let you know that I was thinking of you. I want to thank my listeners for listening and staying tuned to Stay Live and Fit with my wonderful co-hosts, Dr. Frank Snipes and Dr. Michelle Kerwin of the Center of Family, Child, and
Family and Child Enrichment, yes.
Child Enrichment. I am sort of drugged out a little bit here.
I don't care. I understand totally. That nitrous oxide is good stuff there, isn't it?
9 teeth worked on today, so
Wow.
It's been interesting. We can have that discussion another day. But I want to thank you both, thank my listeners for staying tuned, and let them know that if they want to ask any questions, they can always email Liz at stay11fit.com. And thank you again, guys, for taking care of the program. Thanks to my producer, Freddie, and Ken in the studios for helping you guys get situated.
Well, thank you so much, and remember to floss.
All the best, Liz. I know it's a lot. Dental care is not easy.
All right, guys. I'm gonna take off and let you guys finish the job that you're doing. You're doing great.
Well, thank you so
Thank you.
much. You take care. We love you, Liz.
Take care.
One topic is that, just for people to know out there, that with respect to adults anyway, the average age, although this is not always written in stone, is in the mid-30s, but clearly it could be any age. Women seem to have it twice as often as men, kind of a 2-to-1 ratio, whether that's throwing in postpartum depression or even just a statistical awareness that they come into the physician's office and men don't complain about it. But overall, like I said a minute ago, a good 2/3 of people don't get treated. They just ignore it. And I want to really pound that again tonight. Please don't be stoic or brave or
Proud.
think you're being weak. It is an illness, and it affects everything. It affects your relationships with your children, your wife, your husband, your friends, your coworkers, everything. And it is so treatable. Another issue is with respect to the therapy, as we talked about just before Liz had called us. Again, in addition to the medications, there are things like counseling. Counseling, I personally think, does extremely well.
Yes.
Bringing up issues and such, and freeing people of some of the past issues and problems. Yoga, exercise, that sort of thing.
Meditation.
And getting back to the medications a little bit here in this pie of therapy, medications, I think one people fear a lot are the side effects. And I know men are fearful sometimes of some of the sexual side effects which can occur with some of these antidepressants. They are getting better. They are much better. Just like we started with a Model T in a car, and now we have the fancy cars we have now, the same thing has happened with medications. So although there are some still possible side effects along those lines, it is clearly improved from where it was before. And there are certain medications that, such as Wellbutrin and Vibrid, that have essentially no sexual side effects. So again, I'm trying to encourage people to come in and talk about it and to let the physician know, because there's such room to make you better. And overall, anything with respect to, I guess we could talk a little bit about bullying a little bit. I mean, you see
Well, one
that?
thing I'd like before we go to that to talk
Okay.
about, just the importance of getting treated, but also the importance of helping when you see somebody who you think might be depressed.
Okay,
or
you're
you
talking
think
about
might be
coworkers or
coworkers, family
family
members,
members, teachers, with
staging
children.
an intervention. Yes, and the reason I want to bring that out is especially in this world today when we are seeing so much gun violence.
True,
People
true.
being shot. Just road rage is the worst I have ever seen it. Granted, we live in Miami, and I think we were ranked number one for road rudeness.
Yeah, that's right.
But people are pulling guns, and
Yeah, that's
that's
true.
just not normal behavior. That's not just anger. To me, that is anger, but there
It's
can
beyond,
be
yeah.
some underlying depression or mental health illness and so on. And I think we need to not only identify in ourselves when we need to take ourselves to the doctor and get evaluated and be treated and what have you. We also need to when you know somebody that is not quite right.
Mm-hmm. Well, that's
and
true.
we need to step up and say, whether it's tell the teacher or tell the boss at work or whatever, I'm seeing some strange behaviors in this person. And you never know. You might be able to save a mass shooting
You
from
may very
happening.
well. That's a very good
or
point.
occurring. So, mental health issues are to me seem to be on the rise, or they're really, really coming out. And I think we're living in a society today where there is just too much pressure. There's too much pressure. There's too much stress. The economy, the election, all of these shootings that you're constantly seeing, things being bombed around the world, media putting a lot of pressure on women to look a certain way, act a certain way. Men have a lot of pressure on them to be the breadwinner
Production,
in
yeah.
in a society where, we're just coming out of a recession and so on. And kids with the bullying and
Grades
and the pressures of being a teenager, the pressure to smoke, drink, have sex, alcohol. There's just so much on us as a society. Even just emails and text messages and constantly being bombarded with
Right,
social
Twitter and
media.
social media,
and then,
right.
all of the things the effects of social media. Oh, well, she posted on Facebook that she's
Right,
traveling to
right.
India, and this week she's traveling to Thailand, and next
Right.
week she's going to, her life is amazing, my life is horrible.
Yeah.
There's so much pressure coming from all angles to children, adults, and I feel like we're just in a little boiling pot.
We are.
And we're starting to boil over, bubble over, and we're starting to see this acting out. And underlying all of this is anger, anxiety, depression, mental illness, and we need to start being vocal about it. We have to stop with the stigma of it. and the hush hush of it, and the protecting, that person, that family member that acts a little cuckoo, like, oh no, she's a little, stop judging that, stop, just get them that help or start that process, because things are getting out of control, in my opinion.
Well, I think, amen. You're on a roll. You're great. I agree with you, and I'd vote for you if you want. If you run for the, I'd vote for you.
Yeah,
but seriously, and that brings up another point a little bit. Being kind of the autonomous society, nobody really looks at each other like we used to. Nobody sits on the porch like we did in the 1950s and talks and gets to know each other. Everybody walks right by each other. Sometimes doesn't give eye contact. So again, somebody could be miserable. Somebody could be suffering tremendously. And that gets into a whole nother thing about society. But you're right, and that the neighbor that you never talk to could be a time bomb.
Exactly.
And
Exactly.
in fact, you hear that from time to time. He was a nice guy, we thought, and there he goes doing a shooting. So
exactly, or hurting themselves,
and maybe the worst, possibly that's obviously bad, but just living a miserable life. I was talking to a very good friend the other day about her sister who essentially is miserable and doesn't want help and is just hates her job, hates her life, and so that's why it's a big topic to me. Diabetes is easy to treat to a degree. I don't mean easy, but it's more available. You can prick a finger, you can look at a blood sugar in a lab, and there's your value.
It's more black and
You
white.
can look at a pneumonia on a chest X-ray. You can see a fracture on a chest X-ray. You can see a tumor on CTs, and so on and so forth. But this is much softer and much more subtle, and it takes the fact that we all need to be out there looking for each other, keeping an eye on each other, and such. And it makes a huge difference. And I would say that in a clinic like Center for Family and Health Enhancement, I know Dr. Kerwin very well. She knows me very well, even though I haven't been there that long. Physicians and health people get care people get depressed as well.
Absolutely.
And so when I threw that shoe the other day, I didn't mean it. But seriously, but she knows me and she knows what your behavior is, and so that's a big important thing.
Yeah, and actually, I did read an article about depression and suicidal ideation and suicide attempts in the medical community, medical students, residents, physicians. I think psychiatrists actually have one of the highest numbers in suicide.
That, and I understand dentists as well.
Yeah.
But I was Googling that the other day, and roughly about 400 physicians commit suicide a year.
There was a student that committed suicide when I was a first-year medical student.
Really? Due to the pressures and so on?
The pressure. I didn't know him well. I knew him, but I didn't know him well. My understanding was that he didn't pass the year. He had found out that he didn't pass the year, and I believe he had some some relationship or personal issues outside of school. And I think he had wanted to be an ophthalmologist, and so in order to be an ophthalmologist, you have to do pretty well in medical school to place into a residency. And that was what I was told. I don't know 100% because I didn't know him per se well. But yeah, he shot himself and killed himself, and it was very real and very very difficult even for me, to think like I'm in that same boat that he just jumped out of.
Yeah, that's right.
Like
that's
this like boat that feels to me to be sinking too. Med school is not easy.
It isn't.
And he just bailed ship. And am I supposed to be feeling like that, or am I supposed to, And there is tremendous pressure in medical school and residency.
Oh, absolutely.
To be perfect,
Absolutely.
to know everything,
Absolutely.
to be on your best. I mean, it's just incredible. That's a whole nother topic for another show.
It is.
I would love in my spare time to revamp the medical school system because it's ridiculous. And there's just far too much pressure and strain and stress on med students and residents, and it doesn't need to be like that, But, we've got to, as a society, stop being so hard on each other and
Well, we do. You're right.
and
It
rude
is.
and mean to each other. People are people. We're human. We all have feelings. We all want to do well. We all want to be loved. We all want to be seen. We all want to be appreciated to some degree. And we just beat each other up. We really, and it's unnecessary. It's just unnecessary.
Well, I agree 100%, and I know we don't have much time left, but if anybody did want to call in, it's 888-565-1470. We have about maybe 5 more minutes left, but anybody wants to call in, feel free. Again, I do want to stress, and I've said this several times throughout this half hour, it is important, please, to get to a physician or a healthcare professional or a nurse, or let somebody know. Because obviously the things we've mentioned are horrible, but also just I think equally horrible is to live a life of misery when it is totally unnecessary.
And one thing I wanted to say is if you don't do it for yourself, if you have children, do it for your children. And especially if you have young children, because young children pick up on the fact that you're depressed. They may not understand what it is, but they know that mommy or daddy is not nice today, or is sad today, or is crying today. You know, they have an uncanny ability to just sense tension and problem. And as Dr. Phil would say, it changes who they are. You know, it really changes who a child is and will be when they're living in that kind of an environment.
And it spins through their life, doesn't it? It really does.
Yeah. And, you know, it takes a lot of strength to deal with depression, because you have to go through everyday life, plus you have this heavy burden on your shoulders. So you actually have to be stronger than the average person.
Well, I hope this has helped a lot with somebody, even if it's one person. And the people, and let me give you some numbers here. If you do want to contact us, or for that matter, the Center for Family and Child Enrichment, the number for the Center and Family Child Enrichment in Miami Gardens is 305-474-1800. Again, slowly, that's 305-474-1800. And call. That's the clinic for both pediatrics as well as internal medicine. So
as
just
well
make
as
the call.
Behavioral
as
mental
well as
health.
behavioral mental health. Okay, so certainly make that call. And in general, I also work at Presti Medical, which is in Fort Lauderdale, Florida. And my number there is 954-491-6200. I want to thank Dr. Michelle Kerwin, who I work with at the Center for Family and Child Enrichment, a pediatric physician of which I have high respect for.
Thank you.
And I'm Frank Snipes, MD. I'm an internal medicine physician. Again, I also work at the Center for Family and Child Enrichment, as well as Presti Medical in Fort Lauderdale, Florida. And I think we're getting pretty close to about it. So thank you very much, and we will try to help her out next week if we need to, or whenever. So
We look forward to it.
look forward to it. Thank you so much.
Have a great night.
You've been listening to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. Get ready to hop aboard again next time for Stay Alive and Fit with Liz Goodman. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the state.